morning and welcome to this today Adult Health and Social Care Policy Committee meeting. Thank you for attending and welcome to the meeting. The meeting today is open to the public and press with the exception of Appendix 5 of to Item 10. The meeting will be webcast and the recording will also be available for people to view later through the Council's website. It is also possible that Sheffield Live TV will record and rebroadcast this meeting. Please can I require that mobile phones and any other such equipment are switched to silent mode so as to not to disturb the conduct of the meeting. There are no fire tests planned for today. If there is an emergency evacuation, please take instructions from the Council's, from the Town Hall staff, and the assembly point is Tudor Square. So my name is Councillor Angela Argento and I am the chair of this committee, and I will now ask committee members to introduce themselves, starting on my left.
Hi, good morning. I'm Councillor McLean. I'm group spokesperson for this committee.
Morning, Councillor Ruth Milsom.
Councillor Bill Sackville, Saddington Ward.
Councillor Steve Harris, Graves Park Ward.
Morning, Councillor Sophie Crossthorne for Beecham and Greenall Ward and Deputy Chair of the Policy Committee.
Thank you, and if I can ask officers to introduce themselves, please.
Morning, I'm Matt Boucher, the Interim Director of Adult Social Care and Wellbeing.
Morning, Sherry Grant, Assistant Director for Legal.
Fiona Martinez, Principal Democratic Services Officer.
And we also have Rebecca on the tech. I will now move on to item 1, which is apologies for absence. We have not received any apologies for absence. However, Councillor Gilligan Kubo is running late. She had a puncture on her bike, so she's sorting that out. So she might be about half an hour late, hopefully, only. So exclusion of
Councillor McRooney's running late as well. He emailed just before the meeting.
Thanks. Thank you. I've not seen that. Exclusion of press and public. As mentioned above, the meeting today is open to the public press. However, Appendix 5 to Item 10 is restricted, as it contains exempt information described in paragraph 3 of Schedule 12A of the Local Government Act 1972, as amended. If members wish to discuss anything in Appendix 5, we can stop the webcast at that point and then resume after the questions. Declarations of interest. Item 3. Do any members wish to declare an interest on any items on today's agenda? I don't see anybody saying that. And so we move on to item 4, which is the minutes of the previous meeting that was held on the 22nd of October 2025. I'm going to go through each page individually, so I've got for accuracy and if there are any matter arising. So page 11, 12, 13, 14, 15, 16, 17. So are members happy to say that those are an accurate record of last month's meeting or 2 months ago? Brilliant. So we move on to item 5, which is public questions. We did not receive any questions for this meeting. And likewise for item 6, we did not receive any members' questions before or after the deadline. So we move on to item 7, which is the work program, and this is on page 21.
Good morning, everybody. This is your standing work program item. the stage in the committee year where we start to look ahead to the new municipal year. So I would invite members to begin to think about what we might be looking at later on in those meetings, as this is our 4th of the 6 scheduled meetings. If you have any questions, please feel free to ask them. Thank you.
I have just to us one that are on the program with no dates for next year. So one of them is the dining poverty, which is a referral from full council. I think it would be good to start thinking about when that is going to fall, because that is something that we're very keen. And obviously, in terms of the learning disability strategy, it would be good to just have a conversation in a briefing of when is a good time where we are with that, so that we can start thinking about timings. And maybe should we try to arrange a meeting where we can have a cross-party discussion about the work programme in terms of next municipal year? Yeah, brilliant. Thank you. Are members happy to approve the work programme? Brilliant. So we move on to item 8, which is the DAS report, and this is on page 31 of your pack.
Thank you, Chair. I think the microphones are playing a few fun games today, so if it cuts out, please let me know, and I'll wave my arms around violently in panic. So the DAS report this time is covering the usual core items with some updates on specific events from the last couple of clear on key risks. Can you move this? I think it's on. Is that better? I've got 2 people saying yes and 1 saying no. Okay, imagine me, but not a robot. We'll talk through some of the key achievements in the period, and also there are updates on the local account, all-age autism strategy and CQC assessment. So firstly, on to strategy, delivery and transformation. I'd like to draw committee's attention to the recruitment of a to accelerate our work on direct payments. I think you previously had numerous reports on direct payments. Is there any way we can speak to somebody in IT, because I can hear this cutting in and out? It must be really difficult for people online. Thank you. No problem. Secondly, our work and support for unpaid carers. Committee will be aware there is ongoing engagement with carers to make sure that when the new service becomes operational in the new year, we are meeting needs, we ensure continuity and responsiveness. There's been a lot of work on Dementia Day services, so review and redesign is underway, again with extensive consultation and engagement to get the shape of that offer right. We are well into implementation of the Yorkshire and Humber Shared Care Record, acronym YHSCR. That's the expansion of digital records across health and social care with a view to both improving safety and reducing delays. And finally, to touch on our transformation programme. So at last committee, you gave your support for us to go to market to secure a preferred partner. We are hoping that that contract will be concluded and commenced in January. We did last time ask for volunteers who wanted to participate in developing key performance indicators for that transformation work. We haven't had very many so far, so if you do want to get involved, please let me know. I would suggest, linked to the Chair's earlier comments about planning for next year, making sure that you've got oversight of that body of work, making sure the data's clear, the impact is clear and the risks are clear, is possibly, alongside our statutory responsibilities, the most important content. So I really do encourage cross-party representation in that working group so we get it right for you. Onto the performance data. As always, we've appended the detailed dashboard, and I'm happy to take questions on all aspects of it, but I'm going to summarise the key areas. So in terms of assessment and support weights, the median number of days to complete Care Act assessments increased to 32 in the period, though that's set against a target of 35, so we are where we need to be. And support put in place remains at 5 days, which is well beyond or well below the target of 28 days. I would like to particularly call out the impact of the domiciliary care tender in terms of getting the people of Sheffield the care that they need quickly with the right level of quality and choice. And that was a subject of presentation to the Casey Commission that I'm going to come on to update you about shortly. We've seen continued decrease in long-term. That is a positive sign that community-based services and prevention services are working. We also know that we've got good utilisation of our care homes, so we don't have many homes with significant under-occupancy issues, so that balance appears to be working well at the moment. How's that for a bit of technical jargon? Increased to 68%, though we're off our target of 95%. I would also like to draw committee's attention to the fact that completion of annual appraisals within the Directorate is not where it needs to be, significantly underperformance, and we will be having a focus on that this month and next. The annual assurance process is really important in terms of setting goals, supporting our staff and making sure that we've got a really clear view of what's expected and what staff need to thrive within the organisation. On to annual reviews, we've seen incremental improvement here, still not near the target of 80%, but we are at 55%. I think earlier in the year we were hovering around the 50% mark. So whilst we're not making seismic changes on the data, we are steadily maintaining and slightly improving. In terms of occupational therapy, the number of people awaiting assessment increased to 602. The median completion time did, though, decrease to 38 days. However, in order to meet our budget challenges, we have prioritised occupational therapy capacity for assertive reviews where there is the opportunity to drive savings at pace. So that has impacted on our business as usual, but it has also positively impacted on the budget position at the same time. Excuse me. Last time at committee I reported we had issues with the accuracy of data in relation to hospital discharge. This linked to the implementation of a new ICT system by the NHS. Those issues still persist. However, we do have a clear plan to get the data right, and I expect to be able to report that those issues have been addressed by the time we reach the end of the financial year. Our flow at the acutes is good at present, particularly for older people discharge, and the winter plan has already been mobilised as we are well within what the NHS deems to be the winter recording period, which every year seems to creep further and further back towards the summer months. So in terms of our key risks, definitely progress and pace on annual reviews, definitely more work to do in relation to the timeliness of Section 42 inquiries within safeguarding. However, given the overall level of increased demand the Directorate has faced this year, on the whole, most of those performance indicators, as you'll see in the dashboard, are in good shape, are green and are well within trajectory. I'll just touch on CQC next. We are expecting the report to be published imminently. Since committee met last time, we have had a draft report which we were allowed to comment on in terms of factual accuracy. That means we weren't allowed to challenge things we disagreed with. We were allowed to challenge things where we had data to prove that the conclusion might not be in line with the draft report itself. All of that was submitted within the 10-day deadline we were given, and we are expecting the report potentially as early as tomorrow. However, I do note that many councils have been awaiting publication for a significant period of time beyond the date that was originally indicated. In the event the report lands, the committee will be briefed as priority. There is a full communication strategy set up both within and for our external partners, and there will be a full breakdown of what that report has to say, and more importantly, what we will be doing about it for you to review, scrutinise and challenge in committee. Obviously, we'll work that through all the working briefing sessions in advance, and if necessary, we will pull together an urgent briefing to go through the findings ahead of time. On the national policy horizon, as I said earlier, Sheffield hosted a visit from the Casey Commission, who are working on the future of adult social care. Some of the members in the room were in attendance at that session. I think the city gave a fantastic account of itself. We had the voluntary sector, we had people who use care and support, we had care providers, political representation, officers from the council and the NHS there on the day. I was interviewed by Dame Casey myself. That was supposed to take 50 minutes and ended up being nearer 3 hours. I think the work that we've done on domiciliary care is now being held up as an exemplar, is being used positively in the evidence of the Commission in terms of thinking about future legislation. So full credit is due to everybody involved with that, particularly commissioning colleagues and those care providers themselves. We have had some lovely feedback with the Casey Commission indicating that they would like to speak to us about a number of further topics, including deprivation of assets, which Mr. Crowe at the back is our expert on and is now in a position to influence the entirety of the UK, which is something he is very happy about, and I'm delighted to see him do. Before I come to or rather before the chair comes to recommendations, I'll pause at this point and take any questions that the committee would like to ask.
Councillor Dunn.
It's come on again now, look. It's come on again now. Regarding the hospital discharge and the fact that it's been impacting, do we know what cost that has had on? Because this hasn't been an insignificant thing across the city. So, I mean, obviously if people haven't been getting hospital appointments, the cost to social care and across the board is quite high, and that is something that councils and other organisations will have had to find the money for. So are we actually monitoring that?
Thank you. So any costs related to the ICT system or the implications of the data is one for my colleagues in the NHS, and I will refer that across to the Chief Operating Officer. Obviously, in the meantime, we have maintained the same data that we ordinarily would do. So we do have a clear picture of where we are on a day-to-day and a case-by-case basis. In terms of quantifying impact for the council, I can't draw a direct line between their lack of data in terms of discharge and expenditure on adult social care. The flow of discharge is broadly consistent with what we would expect to see at this point in the financial year. And as I said in the broader update, what we are seeing particularly good performance on is pathway 1, where domiciliary care is required. That flow seems to have been consistently working well for a significant period of time. But in terms of the more detailed aspects of the impacts, I will refer that over to Northern General and to Michael and get you a detailed response.
Councillor Sapwell.
Thank you very much, Chair. If I could take you to page 41, and in those receiving services, I know that not every single person will need an annual review, so roughly what's the target to be met there? 22% still feels quite low. And secondly, on 2.46, are these delays secondary to problems with our in-house occupational therapy team, or are these being provided by external providers?
Thank you. I'll answer them in reverse order if I may. So the data purely refers to our internal OT capacity, not any external providers. In terms of the mental health target, the target we would seek to reach is 80%, as we would do across all client group areas. So you're quite right to point out that that performance is significantly below where it needs to be. On the positive side, we had a historical backlog of assessments and reviews that needed to be completed when the Section 75 concluded in 2023. That work is nearing its conclusion, so we will be focusing on the day-to-day assessment and review process. We did bring a paper to committee going back, I think, when I joined in April, that talked through the plans to improve mental health review. But all in all, performance is not where it needs to be. Significant focus will be required this year and next to get us to where we need to be. And what success looks like is a consistent level of review performance alongside all the other operational services that we have. So I wouldn't like to be aiming for 55%. I'd like us to be at a straight 80% across the board, ideally then focusing on how we get to the statutory requirement of 100% within 12 months. What I will say, though, is that all of those reviews are subject to risk management, the ADAS Yorkshire and Humberside waiting well guidance, and there will be weekly reviews of cases to make sure that where people are in particular risk, which is obviously a huge factor for mental health cases, then the teams will operationally reorder those cases in line with that risk.
I may suggest that we have a discussion about the work programme and how we monitor that, actually, because that is fundamental, isn't it? Mental health. And thank you. You asked one of my questions, Councillor Sapwell. Councillor Milson.
Thank you, Chair. I wanted to ask about the support for unpaid carers, and with the service being recommissioned, and it obviously talks about involvement of staff in that process. So I just wanted to sort of understand how much of a kind of genuine opportunity is this for staff to reshape aspects of the service that they might want to improve on, and for people using the service, also is this an opportunity for some improvement and redevelopment if it's needed, and then ongoing after the recommissioning process is finished, will there be some kind of continuous improvement kind of loop there that will involve staff and service users, like more on an ongoing basis?
Yeah, thank you. So the service is moving across to an experienced carer support service in the form of Rotherham. There is a consistent track record there of good performance in terms of certainly the key statistical data that we would look to see. The staffing consultation that's live, there's TUPE implications, so I don't want to get into the HR side of that, but I think there are a number of areas where we can improve our support to informal carers. Obviously, the carer support service is the jewel in the crown in terms of our carers offer. So I will be seeking assurances that staff views are fed into that consultation process. The contract that we will hold defines a whole set of success measures that will be subject to regular review by our commissioning colleagues. And again, linked to the programme for next year, we might want to think about what level of assurance committee would expect to see in relation to that carers offer, because I think it's an area that the CQC will also have views about when they report back to us.
Yeah, no, so I just wanted to sort of clarify why I ask, really, because it's, you know, with the service moving, just kind of moving across, it's kind of, do we end up with a service that looks like the new provider's blueprint, do you know what I mean? Or how much of our personality do we retain around the service with it moving across to a different provider? But maybe we can unpack that at another time.
I think there are certain aspects of the new offer that are fixed, to be completely honest, and given the timescales that we've had to effect the transfer, the most important thing was continuity and making sure that the core support is there. However, this is not necessarily a long-term arrangement. If it works out, we hope it is, of course. But in terms of the ability to shape the service going forward, like any other service that's commissioned by the council, we would expect to see evidence of strong co-production with the people using the service, evidence that feedback from staff is reflected in service design and the nature of the offer, and that all of that is borne out with the statistical data that's fed back to us through the contract or service level agreement.
Councillor Crossthorpe.
Hey, there we go. Thank you again on mental health reviews on page 41. First of all, I want to thank teams for their ongoing focus on improving this situation. I know I get assurances in private briefings, but I think it's important for people who are waiting for a mental health review that they get assurances here as well. What assurances can we get on the delivery of our budget mitigations on the 25-26? Because we've got annual and targeted mental health reviews that we're wanting to work on as part of our budget mitigations for next year. What assurances can we get on those deliverability of those, given that we're currently so far behind the 80% target? Thank you.
The downside of balancing this microphone on all my papers is it does make it more complicated reading them when I need to, so apologies for that. So as with all of the budget recovery work, each one of those activities has a formal project plan, has allocated workers, has timescales set against it, and is then subject to scrutiny internally through Budget Recovery Group. So we've taken quite a forensic and detailed approach to management of budget. You're right to ask the question, because that doesn't necessarily guarantee that the money falls out as per plan. But everything we're doing has been worked through alongside those operational teams to make sure that the activity is happening as it should do. And broadly, we are seeing the level of progress that we're expecting to see at this point. I think it is fair to say that next year is going to be quite a challenge for mental health, given the cumulative impact of historical savings and some of the BIPs that are being moved forward into next year. So in the event that we do find ourselves in a position where we're overperforming on other savings line, and that is currently the case in some areas, then we might need to have a rethink about how we prioritise there. But at the moment, it's a question of sticking to the plan that's been prescribed with the long-term view in terms of my response to Councillor Satwell about getting properly back into grip with these cases. And I think the final thing I would say on the topic is, in terms of assurance, I am not assured at 21%. You should not be assured at 21%. Our level of aspiration must be higher than that. This is a case of supporting some of the most complex people in Sheffield whose needs change and fluctuate on a rapid basis in some instances. And until we get to a stage where we can say that we're getting through the majority of those cases in a timely way, you as a committee have every right to challenge and ask questions and push and seek further assurance, because we are not where we need to be yet.
I have a very quick question myself. The ones on mental health have already been asked. In terms of page 35, 2.9, about the shared record, do we know who the provider is and where is the data being stored? Could we ask that question if we don't?
So, just to give assurance in terms of data protection and data integrity, the number one factor that holds up shared care records is the information governance process at the start. So we've been through extensive assurance around information governance. In terms of the detail about who provides the technological aspects of the service, I'll find out and get you a written response, Chair.
I would be particularly interested in understanding whether they would fit our, as in Sheffield City Council, ethical procurement kind of guidelines, the new ones that we have been approved.
Okay, I can ask.
No further questions, so I'm going to bring that to a close. The recommendations for this report are on page 32, and they are as follow. It is recommended that the Adult Health and Social Care Policy Committee 1 notes progress in delivering upon the adult care strategy, living the life you want to live, notes the performance update in areas for prioritization and focus, including performance dashboard at Appendix 1, notes the strategy delivery update and achievements for this period, and number 4, notes the progress of our preparation for 6C following the site visit in September and next steps. Are members happy to agree on those recommendations? Brilliant. And so we move on to item 9 on the agenda, which is city-wide care alarms, technology-enabled care, charging policy. Paul, and do you want to start us on this?
Good morning, everybody. I'm Paul Higginbottom. I'm the service manager of Citywide Care Alarms in Sheffield, and I'm the lead for the tech transformation in the city. And I'm pleased to welcome Charles Crowe, who is co-author of the report and our subject matter specialist. Okay. Good. Just bear with me a second. The report outlines a proposal for the introduction of a new technology-enabled care charging policy to support the citywide transition to a new tech-first approach. The policy aims to make tech services delivered through citywide care alarms more accessible by means testing alongside care and support for those eligible for adult social care and the move away from a traded service model. This report builds on the report we took to committee in March this year, where the new tech service delivery model was approved, and we gave a commitment to come back to talk about the new charging policy and make some recommendations. The recommendations, number 1, to approve the new tech charging policy, which will see tech services means tested alongside the care and support for those eligible for adult social care, as I said earlier, to note the move to means testing alongside that care and support and the move away from a traded service model, and to note that further stakeholder engagement will be undertaken should the report be approved this morning. I'm now going to pass you across to Charles, who's going to go through the proposals.
Hello, hopefully this is working now, right. Technology, we all love it. So the detail of the proposal is that we will include tech-enabled care within the support plans that social workers produce for an individual. This will mean that it's subject to the means test the same as any other social care. That is a change from the current approach, where if someone has a citywide care alarm, they pay for that, although where they're getting both citywide care alarms and social care services, that their charge for the social care is reduced by the amount that they pay towards their citywide alarm. So one nets off the other. Now, by including them within one plan, this moves us towards the tech-first approach. This supports clarity. It also means that people only get one invoice rather than 2. The other aspect is that a small proportion of the people currently getting both would not have to pay if we were means testing. The majority would. There's 1,750 people approximately receiving both services. Of those, 250 don't have to pay towards their care when assessed. So they're currently paying for citywide care alarms. They would cease to do that under the new proposal. That has a financial implication for the council of an estimated £95,000 a year. This is covered within the budget surplus in citywide alarms, so there's no additional pressure there. Those individuals are the most financially excluded that we support, so that is a good area to target any resources. People who are privately requesting citywide alarms and don't receive other services will continue to pay, will continue to be invoiced. So there's no change for them, there is just a change for the people who are getting both services. I think that covers the sort of the summary of those points.
Thank you, Charles. As part of the work that we have been undertaking, we've also been looking at the redesign of citywide care alarms to ensure it's fit for the purpose and going forwards to support the new tech service delivery model. Those developments have gathered pace. We are going to be digitising the service, taking us away from the reliance on pen and paper. That's going to have a range of benefits, including better workforce satisfaction, having better tools to work with, greater customer experience, improved information management, security, and better reporting capabilities. We continue to work hard to be able to improve those service deliveries because it's important that we have everything in place ready for the new tech service delivery model. And that kind of concludes today's overview of the report. So, any questions? Thank you.
Are there any questions from anybody? Councillor Harris, did you have a question? Councillor Dunn, do you want to have a go at yours, see if it works this time?
Sorry, it was about the implications. So just reassurance, and I think I've already had this in briefings, that no one will lose out as a result of this financially. Can you just give reassurance? And,
Yes, there's no one who will lose out financially on this. There are only winners on this proposal. There's no one who will be paying anything additionally.
Councillor Dunn.
Thank you. Oh, wow, we can't even get a microphone to work, never mind digital access. Joke. My main concern is about people who are not digitally included, okay? And those that find it difficult. And as we know, a lot of older people, especially as they get poorly, get very, very scared. So what are we doing to mitigate that? And how are we going to absorb that cost? Because so many families now are struggling. And I'll be honest with you, it would frighten me if I had to go digital at 80 odd years old if I was living on my own. Well, it frightens me now. So what are we doing and how are we going to work together across our communities with our councillors, our organisations to reassure people?
Yeah, I think it's a really good point. The technology has evolved since the early 70s. We have 8,500 people in receipt of a citywide care alarm service, and the basis of the service is a care line and dependent that somebody wears around their neck. We recognise that people need to be supported in how they use that technology. And we have a really good installation team at citywide care alarms, and when they actually come to install the equipment in people's homes. They actually take them through how to work it. The technology tends to be very intuitive and very simple to use, but we have recognised that we do need to improve that digital knowledge of the public across the sector, and there are other initiatives taking place outside our directors, for instance in communities, that are giving support in libraries in terms of digital training. But the actual tech itself is fairly basic and simple to use.
Yeah, thank you. And I want to thank you for the work that you've done in the past, because I know how important it's been both to my family and to lots of my constituents. So just want to say that. I still have concerns about how we're going to communicate this, because it will worry a lot of people. So I understand going into libraries, but not everybody goes into libraries. So I think it really is important that the community, we just launched a community strategy, and we are pushing for more independent living, for people to remain out of, to live independently. So actually this should be growing as we've got people that are living in that way. So I really would like to see that integrated into that, and to make sure that we pass that knowledge on, not just to those that need it, but to those who have got families and conditions that we know in 6 months' time, 12 months' time, they may need it, so they're preparing and not being reactive.
Yeah, I will absolutely take that commitment forward from today, and we'll make sure that we work with the community strategy and we really have something that can give people the right knowledge and understanding.
Thank you. Councillor McLean.
Thank you, and thank you for your report today. So 8,000 people are using tech at the moment, the alarm service, and I think you just mentioned the alarm with the button that people press, and that's, I think, when most people think about this kind of service, that's what they'll think about. But we've heard over the last few years there's more on offer tech-wise at the moment, and I just wondered, what similar to Jane's question, but a bit further on, what's our sort of plan for making sure we increase the number of people using those services and make people aware of the full breadth of offer that is available at the moment? Thank you.
Yeah, our key driver at the moment is around our frontline practitioners, improving their knowledge and understanding and confidence, which we're doing through some tech know-how workforce development. We're doing lots of engagement sessions with those teams. I think some of you attended the Tech Marketplace event we hosted in September. It's really improving that knowledge and understanding and letting them recognise the many benefits that tech delivers to the people they care for, so that we really embed tech as part of that tech-first approach. So they're kind of our ambassadors, disciples, however you want to term it, that will go out and really start to promote this during each assessment and review of care packages. And I think that's the first point, to really get that on board and bring people with us. But the training is really important, the knowledge we give to those people at the same time.
And that's part of the benefit of including it within the support plans. It makes it part of that support planning cycle and encourages social workers and social care practitioners to see it as a core part of the offer, and that will increase the uptake, or we hope that will increase the uptake.
Councillor Milson.
My question's around the alignment of our tech strategy with the NHS 10-year plan shift to digital, and how costs kind of are going to work out over time, given that the NHS plan is to shift more care into the community setting, and that you enter the area of continuing healthcare and things that perhaps have been jointly funded in the past. But as far as I'm aware, we don't have any kind of joint funding agreement with the NHS specifically around our tech services. But it seems like there's going to be some crossover, and it moves into continuing healthcare kind of sphere. So how might that look?
Yeah, we are working closely with NHS colleagues. Kelly and I are going to be having a meeting with senior leaders in the NHS at the current ICB, both at Sheffield and a regional level. Our tech strategy is an adult social care strategy currently. Our ambition is always to have a joint tech commissioning strategy, which includes the health contribution in it, which would include funding at the same time. And we continue to that end. I mean, we work very closely with the continuing healthcare team at the ICB. They've been part of events and training to ensure that we are embedding tech as part of that tech-first approach. But we need to realise that ambition to bring together a joint commissioning strategy for technology-enabled care in the city. We continue to work to that end, but we're not there yet. There's still lots of work to be done.
If I can also add, and I'll bang the same drum there, part of our existing joint funding approach with ICB colleagues is through the support planning process and allocating costs and splitting the costs on the support plan. So again, this method aligns with how we currently share costs on an individual basis, so it will support that as well. And make it more transparent for health colleagues and make that calculation of shares on individual service users funding easier by sticking to the same pathway we use for other jointly funded packages.
Right, I'm going to draw that to a close. The recommendations for this paper, and thank you so much for the work on this. The recommendations are on page 68. Paul has very kindly read them at the beginning. Do people want me to read them again, or can we take them as Paul read them at the beginning? Is that okay? So we got 3 recommendations on page 68. Are members happy to approve those recommendations? Great, no dissent. Thank you so much. And we move on to item 10. Which is the market sustainability and commissioning update, and Catherine is there to give us read us the report.
Hi, good morning. So as with previous reports for adult care and wellbeing commissioning, this report covers our activity, our impact and our intentions across 3 key markers for achieving our Care Act duties as they relate to market sustainability, sufficiency, quality and value for money. In terms of sufficiency, included in the papers is our market position statement in Appendix 1, which provides an overview of our demand, our direction and commissioning intentions across all of adult care and wellbeing provision over the next 12 to 24 months. And the report also notes some key commissioning intentions for the coming year with an update for assurance for members on our out-of-city placements. Having a safe, sufficient and stable market is also dependent on having a valued, skilled and sufficient workforce, and section 3 of the report provides an update on our workforce strategy and progress towards ethical care charter. And section 4 of the report considers our processes for ensuring that provision meets the standards we'd expect, our current knowledge of the market and our improvement priorities, and detail on that is provided in Appendix 3. The Monitoring Advisory Board provides for greater depth and scrutiny of our quality assurance and market oversight, and largely linked to staff and capacity pressures, it hasn't been regularly meeting over the last couple of years. The report, as written, implies something different, but just to confirm it is there and members have been elected to it, and the appendix attached in Appendix 4 sets out a timeline. Now we've got that capacity to have a much more effective plan across 2026 to allow some of that depth and scrutiny of provision. And finally, in section 5, there's a note on the process that we took in 25-26 around fee uplifts, noting that proposals for 26-27 will come to committee in the new financial year. That's a very quick run through because there's lots of appendices, so leaving time for questions.
Before I take questions, just a reminder that if you have any questions on Appendix 5, this is kind of restricted, and therefore we leave it until the end of the questions, and then we can stop the recording. Does anybody need to ask any questions on that? Can I just ask? Yes, so there is a question here. So we'll take other questions, and then we'll stop the recording for a few minutes, and we'll take that one on the appendix. So I've got Councillor Ayres wanted to ask a question on the rest of the report.
Yeah, it's more, yeah, thank you. It's more of a comment, really. I think I welcome this report because I think it's a very comprehensive report, and it outlines where what I think has been required for quite some time now is identifying where the areas of demand lie across the service, and I think that's very helpful in the transformation working forward in determining, you know, where we need to concentrate our efforts. So thank you for that.
Thank you, Chair. It's just a broader question about workforce, and thank you. I echo what Councillor Ayres has said about the comprehensivity of the report. Excuse my husky voice, I'm a little bit poorly at the moment, but overall on workforce, a few weeks ago the Nuffield Trust released a report about the issues as overall the care sector nationally, as we know, relies on immigration as a workforce. The fair pay agreement from the government doesn't kick in until 2028, and even then the first year of that won't go very far into encouraging British nationals into the sector. It seems that health and care worker visas since March last year are now a quarter of what we have. Well, now what we have now is a quarter of that. So before it was 2,500 nearly, and now we're getting 600 across the city, across the country. Sorry. And as much as we can look at that in the abstract, I know from my own work recently, there was a PA that isn't employed by my work, but comes in to support a member on services that I work on, and is now struggling with his visa renewal because his employer has changed their policy just before his visa renewal on sponsorship. It's a concern for me that someone that's so good at their job and brings so much to the city of Sheffield and works with people and helps to benefit them is potentially going to be lost as a result of this. But also it will disrupt that continuity of care for the person that they support as well. In your conversations and teams conversations with providers, is this something that's reflected as a concern when you're talking about staffing in the workforce? And is this also a challenge for us as a local authority?
When we talk to providers, I think that there's certainly a lot of attention generally on workforce and making sure that we have attractive career pathways for people, that we're both able to recruit sufficient workforce, but that is possible for our local communities. And yeah, that there's retention policies and things in place so that people don't leave the sector. We in Sheffield support regionally displaced workers who might be here on overseas visas, which puts us in a really strong position in terms of understanding the market. So I would say there's generally an awareness, certainly with our care and wellbeing providers. When we went out to tender, we wanted to make sure that they had the required licences to be able to do that. And I know that a lot of our care home providers have also taken up that licence. I totally take your point about the continuity of relationship though, and how important that is for people. So I think in answer to your question, there are many issues that we know place risks around recruitment and retention to the care workforce, one of which is changing policy, but that providers at the moment in Sheffield are working well and with us to try and predict that.
Councillor McLean, do you want to ask a question on the main part of the report? Yeah.
Thank you. Thanks for your report. Just a question about, there's a couple of questions. First one was about paragraph 2.18 on page 129 of the pack, about the rolling respite, which was about how only one of the 65 allocated individuals are using their full allocation, leaving some of the budget unspent and the purchase beds underutilised. I just wonder what the reasons behind that were, because that seemed like quite a lot. And then just also, I was reading on the next page about the community living networks, which sounds like a really interesting model. And I just wondered a bit more sort of practically what that looks like for people, because it talks about how, the report talks about how you know, people sort of choose who they want to live with, and is it quite an organic thing, or is it sort of how organic versus formalised is that process, and sort of practically what will that look like on the ground for someone who's opting to go for the community living network? Thank you.
Thanks. So I think anecdotally, some of the reasons behind the rolling respite not being used is that some people are able to plan when they might want respite in advance, but for quite a lot of people, it can be unplanned respite, and that's harder to utilise. And so this is relating particularly to that planned aspect. So in our recommissioning, we definitely want to be working with care home providers and with our new care home brokerage team, which is getting going, to be better able to understand current vacancies across the city and what providers, particularly care home providers, need in order to be able to take less, not necessarily emergency, but less notice admissions, and that will come from that. In terms of the community living networks, yeah, I think it is really interesting. Other areas have done it before, and I think it's really positive. I think the idea around the sort of choice in people living with communities is it moves people, again, a step away from that sort of residential model, where actually people might have relationships, friends, and they can secure their own sort of tenancies in with people that they want or in communities that they want, and there's a sort of hub organisation that starts them off, linking into the geographical communities to begin with, but also each other, to develop that sort of organic independence in the community. So Caroline Stiff in our team is working hard on that at the moment, and we can expect a more detailed report, but I think it's a really positive model for adults with learning disabilities and mental health.
Thank you. You're right. Sound great. Thank you.
Thanks, Rebecca, for that. Don't have sun shining in my eyes anymore. I have Councillor Gilligan-Kubo, and then we are going to go back to Councillor McLean.
Thank you, Chair. Mine's a general question, and it relates to page 154 in general, but I noticed that we have a higher spend than most of our core cities, and I just wonder, when this is worked out, this core city average, does it take into account the indexes of multiple deprivation, and is that one of the reasons we have a higher spend, or is it just that we provide a really good service?
We do try to provide a very, very good service. I think that these figures are good indicators, good benchmarks, but each local authority might include slightly different things in each category, which can cause some difference. Sometimes it might be relating to the cost of care in different cities, and certainly rurality can tend to drive some costs up in some provisions, and we've got a lot of more rural areas than other core cities. And it might also, we might also see some of that changing as we move into more enablement-focused, strength-based delivery as well. I don't think it's directly related to the indices of multiple deprivation.
Just to add to that response, I think the benchmarking data you're referring to is the Local Government Association Use of Resources Analysis. And what that analysis does is look at the population and look at the relative proportion of the populations that are served by adult social care, and then benchmark to attempt a like-for-like basis comparison. So indices of multiple deprivation wouldn't be an explicit factor, but should be reflected in the proportions of people served. We have actually just had the 2025 report for Sheffield, and what I'll do is circulate a copy of that report to committee, but also some analysis that gives a bit more detail about what it actually means and what the planned transformation work is likely to do in terms of changing our position in comparator to core cities. But it is quite an interesting read, and comparisons like that can, I think, tend to be more indicative than pure like for like, but understanding the parameters that sit around that will be very helpful for the committee, I think. So I'll get that piece of work done for you, Councillor Cooper.
So, Councillor Milson.
Thank you. Really interested in the community living networks stuff. And sorry if I've missed any conversations about this already in briefings that I haven't made, but I'm really, really keen to learn more about the promotion of community relationships, peer support, support for individuals accessing their community, social activities, identifying volunteering and work opportunities, all of that holistic, stuff that sits around formal care, and how that is going to work out in practice. I might be naive, I might be extremely naive, but this whole area of holistic care seems to be the very cheapest, the very lowest cost to an organisation, because they're things that already exist, and just often it's just literally signposting. But I'm wondering, it's kind of linking with thinking about that the Care Academy's been going for a year, just over a year now. How are we kind of doing with our care professionals feeling confident to signpost people and plug them into local activities and stuff like that? And, with the domiciliary care being more location-based, is that starting to play out in practice, that we're getting a more location strength-based kind of offer?
Sorry, can I just take Councillor Dunn as well, and then we will draw it to close and go into the closed section. Thank you.
Anna, that's it, it's working now. Obviously, it doesn't like me today at all. Right, page 163, where we were looking. It starts on there. I'm really, really keen to know, with the activities that you provide for the people with learning disabilities. You're saying that we've got so many across boundaries, etc. How are we making sure that we are reaching all our communities on that? Because I do know in my own ward, a lot of people travel from Stocksbridge into Parsons Cross to receive absolutely brilliant, excellent support, but it is still quite a long way. Are we looking again, and I mentioned the community strategy earlier, are we looking about how we're getting services more localised? And this is probably going to be the same, similar to the question on 169 on the dementia. It says here that currently we can't look at how we're delivering that till 2027. Well, that's only in a blink of an eye away, really, isn't it? So we are again looking at how we are delivering these services and how we can actually localise them better. Because I know that's at the heart of what we wanted to do as a council, but we're also aware that it takes quite a long time to steer the tank down the narrow street. So it must be started now. So it was on page 163 and 169. It was, thank you.
Thanks, Catherine.
Thank you. They tie together quite nicely, really. Councillor Milson, no, you haven't missed any briefings on that, and there's more to come on the community living networks, and the intentions, the commissioning intentions, I think, start on 100 page 127 through to 129, they'll all come back to committee with much more detail before we do anything about them, probably in March. So that happens to cover unpaid carers and dementia advice services, as well as the community living networks. So I'll just stay on community living networks for a minute to say that the question around activities outside of the home for people with learning disabilities, that model is one of the ways in which we can try to make sure that we foster those community-based activities nearer to where people live and engage people in their communities. We've got a really good variety of day activities actually, but a lot of them are building-based, and a lot of people don't necessarily want to do that every week. They want to be much more active in their own communities, so definitely that's sort of one of the intentions behind the community living networks. In terms of the dementia timescale, yes, that work started. We have reasonably good provision across the city, but it does involve travel, and a lot of it is linked to what we call people keeping well, but other areas might call those community hubs, and they tend to be places where people go, where there are a lot of other opportunities for people to connect and get advice. And so we want to be able to maintain that access for people. It's not just important for people with dementia, it's important for people who are caring for people with dementia. And it's a real push for our early intervention and prevention offer, actually, that people are able to access things like that in their community. So again, in March next year, you should be getting some of the outcomes of our consultation and our engagement and the redesign, so that we're moving towards that, in time for 2027, which absolutely is a blink of an eye in terms of commissioning. A terrifying one, half a blink. And then finally, Councillor Milsom, you asked about whether we were seeing any of the sort of benefits we expected from area-based home care coming to fruition. And Matt mentioned earlier the Casey Commission. I was fortunate enough to be there, and one of our providers, Be Caring, spoke about a model that they've got. So their staff have block contracts or fixed term shifts. They're paid on shifts, which allows them flexibility, and they gave an example of being able to use some of the time that affords them to work differently with people, to work with a woman who hadn't been out of her house for a year and now is regularly attending a kind of community centre near where she lives with a bit of support. So we are starting to see some of those positive impacts, and one of the other benefits of that particular way of contracting was because people have those fixed areas, providers aren't in competition, and that really helps us to foster the sharing of best practice and ideas, because there's a real benefit in all of our providers working together, because they're not spending their time trying to get the packages from us in different areas. So emerging. Thank you.
Great. I'm going to suggest that we now close pause the recording. Hear the question on the restricted appendix, and then we come back and look at the recommendations. Is that okay? Yeah. Thanks, Rebecca. Come back. So, and thank you, Catherine, for all the responses. And we are going to the recommendations, which are on page 124 of the agenda pack. There are 7 recommendations linked to this report, and they are as follow. Adult Health and Social Care Policy Committee is recommended to 1. Note the refreshed market position statement for 25-26. Note the commissioning intention schedule for consideration by the Adult Health and Social Care Policy Committee over the next 12 months. Number 3, note the progress update on the Adult Workforce Strategy, Ethical Charter and Care Academy. 4, note the Market Oversight Delivery Report update for Q2 25-26 and ongoing work to meet our duties under the Care Act in 2014 to ensure market sustainability. Number 5, note the strengthening of the Monitoring Advisory Board governance to support effective oversight of quality and sufficiency. Note the work undertaken and position on provider fees in 25-26 and update on 26-27 fees proposals. And finally, number 7, request the strategic director for adult health and wellbeing continue to bring regular commissioning strategy update to the Adult Health and Social Care Policy Committee. Are members happy to support those recommendations? Great, thank you very much. And we're moving on to item 11. Thank you, Catherine, which is on page 285 of your packs. Thanks, Jane.
Thank you, Chair. I'm Jane Wilby, Assistant Director of Finance and Accounting. I'd like to present both items 11 and 12 together, if that would be okay.
Please do.
Thank you. So firstly, I'll provide an overview of our 25-26 budget monitoring position and highlight the key pressures, the actions that are underway and the outlook for the remainder of the year. And then the second paper is a direct response to the amendment made at the September committee, that a report on how the Council got to a financial position of 31.3 million in-year budget variance, including an examination of governance, budget mitigation, and whether appropriate reporting and policies have been followed, and a copy of the value for money report, the draft report that was from our external auditors that was presented to the Audit and Standards Committee on the 18th of September. So the headline position at Q2 is that the Council's projecting an overspend of 23.6 million, which is 4.6% of our net revenue budget. This is an improvement of 4.6 million since Q1, reflecting the impact of the targeted mitigations and tighter spending controls. Our aim is to reduce that overspend to below 20 million by year end and continue to drive to reduce those overspends. The key drivers remain consistent with the previous quarter's report in adult social care, children's services, home to school transport and homelessness. In terms of the actions and mitigations, targeted work is underway and senior leadership are closely overseeing recovery. In children's, the positions worsened by 4.9 million within the quarter to a 19.8 million overspend due to rising demand, particularly in expensive placements. The service remains committed to reviewing these high-cost placements, expanding kinship care and developing new fostering models. In home to school transport, the positions remain stable from Q1 with a 6.6 million overspend, but actions around demand management, expanding personal travel budgets, improving fleet efficiency and reducing single taxi occupancy are underway and expected to yield results in the next quarter. Homelessness services are forecasting 2.1 million overspend on temporary accommodation, but this is a comparable improvement of 5 million on the previous year, and the actions being taken are making a real impact to reduce the use of temporary accommodation, including stepping up prevention activities, introducing occupancy controls, improving void turnaround times, and a change to the allocations policy that have all made a big impact in the budget position. As a response to the financial position, organisation-wide spending controls are now in place. Recruitment restrictions, vacancy factors and tighter controls on discretionary spend have been implemented since September, and there is an established exemption process for any resourcing decisions for roles that are regulatory requirements, health and safety critical, income generating, grant funded or have a direct impact on delivering the Future Sheffield programme. We've seen a 3.7 million impact of introducing these vacancy factor budgeting and a positive response from services from recalibrating forecasts to ensure that spending plans are now aligned to the new reduced expenditure targets. There's also corporate mitigations totalling 22.8 million in the outturn position, which include allocations for housing benefit, high-cost subsidy, high-cost placements, and our 24-25 collection fund surplus, which usually we would have taken to reserves. So moving to the adult social care budget position described in the second paper, the report provides a transparent overview of the adult social care budget for 25-26, which highlights a significant in-year overspend of 31.3 million at Q1. The financial challenges driven by several factors, persistent increases in demand for services, greater complexity of care needs and ongoing funding volatility. So whilst there's been a 1.6 million improvement in the Q2 outturn, the underlying pressures do remain substantial. The report details how we got to this position and makes clear that the issues are not isolated to a single year, but reflect a structural challenge within adult social care budgets, with overspends rolling forward from previous years and compounded issues with BIP delivery. The Council's responding by strengthening governance, adapting business planning approaches and implementing targeted interventions to improve that financial outlook. So the draft report that describes the value for money audit, which is conducted by KPMG, is also linked to in this report. It was presented to the Audit and Standards Committee and identifies that adult social care is a significant financial risk for the Council. The report notices the sharp increase in demand during 24-25 that led to substantial overspends, raises concerns about the budget assumptions for 25-26, that they may not fully capture these ongoing pressures. KPMG recommend that the Council strengthen arrangements for understanding and managing demand within adult social care, ensuring that the budget setting is based on the most up-to-date and accurate data, and have a clear plan to mitigate future risks. The audit also calls for regular monitoring to the Adult Social Care, the Audit and Standards Committee, so that the effectiveness of the interventions can be tracked and adjustments made as needed. In response, the Council has reinforced governance arrangements and oversight mechanisms. New and existing forums, such as the Adult Social Care Improvement Board, chaired by the Chief Executive, the Adult Savings Governance Group and the Joint Efficiency Group, all provide robust scrutiny of financial and operational performance, and these groups ensure that savings initiatives are realistic and achievable and that progress is closely monitored. The report analyses the impact of rising demand, particularly in learning disabilities and mental health, where demographic trends and complexity have driven costs above budgeted levels. As discussed, a spike in demand in autumn 2024, which is shown in chart 1 on page 316, was not captured within the business planning cycle, which meant that base budgets were actually behind costs at the start of the year. We did recognise this risk and make a late allocation of additional budget of 3.1 million above the modelled growth, which is shown in chart 3 on page 318, but unfortunately this has still fallen short. The Council is embedding lessons from previous cycles, such as the need for more realistic savings plans, earlier implementation of transformation measures into its business as usual processes, and for 26-27, business planning has been strengthened through zero basing of budgets, realigning of budgets and closer incorporation of that care purchasing data. Growth has historically been calculated using a combination of 3-year growth trends and POPI data, which is projecting older people population information data, and that was designed to capture the underlying growth patterns, which has provided a reliable basis for planning previously. But for future planning cycles, we're going to be using a 2-year trend analysis approach and incorporating mid-year trigger base points to make sure any demand shifts are identified and addressed earlier. The Future Sheffield Transformation Programme is central to the Council's long-term financial sustainability, driving service redesign and digital innovation. Within adult social care, a dedicated transformation plan approved by committee in October focuses on accelerating the change, modernising services and improving outcomes. This is a collective effort and it's already delivering improvements with a strong engagement across the organisation to make those changes a reality. Overall, the environment does remain challenging with continued uncertainty around government funding. We expect to receive the full details of our multi-year settlement next week to enable us to finalise budget setting for 26-27. So whilst we have made good progress in reducing the overspend for the Council, significant pressures remain, and our focus is on maintaining these robust controls, improving processes and delivering transformation. I hope the reports provide the committee with the assurances that the Council is responding proactively to the situation, and I'm happy to take any comments or questions if there are any.
Councillor Nielsen.
Thank you, Chair. Thanks, James. I understand a lot more about this report than I usually do, so that's a that's a good indication. Can I go back again, sorry, to the health income undeliverable saving? I'm presuming this refers to continuing healthcare and the saving that was projected from last year's budget, which I think some of us were sceptical about at the time, whether it would be deliverable, knowing what the financial constraints on the NHS are locally. So I presume that when it refers to health income on page 296 as an undeliverable saving, that is referring back to that ambition to realise, I think it was £1 million saving and possibly more. Has the situation improved and are we still slipping behind on that? As in, do we still consider that we are incurring more cost than we ought to through CHC? So is that kind of, if you look at it in a layperson's kind of terms of maybe we feel we've overspent in relation to what the contributions have been from the NHS. Is that situation, has that improved? Like, are we stabilised in us not picking up the tab disproportionately in CHC? Difficult question.
It is a difficult question. In terms of the undeliverable savings, there is still work is underway to make sure that we are going to be delivering a proportion of those savings in 26-27. In terms of the relationship with the NHS, it is a very difficult environment in terms of the kind of the pressures that they're under, actually. So the relationship is, you know, we're working with that. I think Matt probably wants to come in and add some further context. It's obviously closer to that relationship and negotiation, but I think we do still feel that we are underfunded in terms of our income is, and there is further work to be done there, unpicking and getting to a more equitable position. But Matt will probably want to come in with some further comments.
Thank you. I'd like to give you a short, medium and long-term answer, if I may. In the short term, on not just continuing healthcare, but Section 117 aftercare funding and joint packages of care, oft referred to as JPOC here, there is line-by-line, case-by-case negotiations that we've been working through with the ICB for the last 4 months. We're nearing conclusion on Section 117, and we are jointly aiming to have the CHC discussions closed off this year. That's ambitious, given the breadth of cases. I think the ICB have worked constructively with us to go through the issues. 2 of the confounding factors in getting full resolution is the availability of nurses to do the reviews and the amount of social work time required to work through the processes, particularly where those cases are of some considerable age. In terms of the medium term, there is a piece of work led by ADAS Yorkshire and Humberside regionally to look at best practice across the region, look at the national framework and make clear arguments where we feel that that process could be strengthened and better administrated. And that links to all the changes that are going on in the ICB at the moment, because it's possible that in the future, continuing healthcare, Section 117 and JPOC is administered sub-regionally, not locally. So that adds to the importance of getting to a place where both parties are assured sooner rather than later. And I think the third piece of work that we've been doing, we've worked alongside an organisation called Riverside Consultants. The 2 leads within that organisation both contributed to the original national framework for continuing healthcare, and they're providing some very clear advice and guidance and training for our staff to help them as they go through the processes. Going back to your original question, which was, were our original assumptions about how much we could achieve realistic? I think not. I think the concerns committee raised at the time were correct. I think there is a temptation sometimes for both health and for the local authority to assume that moving money one side of the line to the other can resolve underpinning financial issues. We know that the ICB is experiencing severe financial challenge, as is the Council. I think what good looks like is we do get to the end of that list on the individual cases, but the most important thing is that whatever structure the ICB takes in the future, all we have seen in the space, particularly of learning disability and autism, is growth in the number of people requiring support, increases in the acuity and complexity of need to meet those support requirements. And we are certainly budgeting as a council on the basis that that will continue in future years and therefore needs to be reflected in growth. Any assumptions the ICB makes about being able to decrease its overall expenditure on continuing healthcare, Section 117 or JPOC, in my view, would be ill-advised on the basis of all the data, all the growth forecasts, and all the information coming through transitions that we can see. So that's what we're trying to do to address it. It is trying to address a financial challenge between 2 organisations that are in a difficult financial space is not an easy thing to do. And I will certainly be extremely prudent in future estimates about what CHC will and will not bring. However, I also think we do need to make sure that the national framework is not lost in all of this. It says what it says. It was written in a way to make sure that people who shouldn't have to pay for care, that should be free at the point of delivery because it's an NHS service, not a council one, have their rights respected. And we've got a responsibility to make sure that that is the case, just as much as we do to administer the Care Act accurately. That's an extremely lengthy response to your question. Apologies.
Thank you. Go on.
It's just, thanks, Matt. It's just, I've asked this question before. It's really a scrutiny question for the NHS, but I wanted to get your answer on it. The number of nurse assessors who undertake the continuing healthcare assessments and get those packages sorted quickly. You've commented that there are problems in that workforce. They're employed directly by the ICB. Has that got worse? Just yes or no?
Yes or no?
Yes.
I have Councillor Ayres and then Councillor Sapwell. Is that okay?
Thank you, Chair. Yeah, I welcome the report and I welcome all the interventions. The question I have is, well, I suppose it's sort of a question, a comment really, is that I welcome all the interventions to all the various different levels, and it's starting to get very, very complex. So my concern is, I thought, at the back of my mind is now, the lines of communication and ensuring that the lines of communication, particularly with this policy committee, are kept, I don't know, clear and regular as appropriate. I mean, there's so much information coming all the different partners. Matt spoke about health, and the implications of health outside of the corporate, council corporate organisation. So my concern is that there's a danger that some of those lines of communication might block the actual delivery of the transformation programme.
Matt?
Thank you. I couldn't agree more, and try and making the complicated simple is a personal mantra, not least because I don't have the intellectual capability to think about things any other way. I said at the start of the committee that I really encourage representation cross-party to get the KPIs linked to transformation right. I think that will help answer the challenge that you've just set. The other thing I wanted to say in response to your question, Councillor Ayres, is next year is not just delivery of transformation, it's also making sure we land all the pre-existing commitments in the MTFS and the Roll 4 items that Jane described so eloquently earlier. So what I want to be able to provide to committee is a really clear overall position that describes where we are on change, where we are on BIPs, where we are on the in-year work that we need to do to get the budget to land as per the level it's set at the start of the financial year. And the money is the money ultimately, so it's my responsibility working in partnership with my finance colleagues to make sure that A, we do that, and B, it's articulated in a way that is relevant to the people in this room.
I have Councillor Sapro, Councillor Crosthorne and Councillor Dunn. Does anybody else want to ask any questions, or can I just say that those are the three that I'm going to take? Brilliant. So can I take Councillor Sapwell first?
Excellent, thank you for your report. And I mean, when juxtaposed against the NHS implementation of recruitment freezes, which is leaving physiotherapists, nurses, midwives, doctors unemployed when we've got long waiting times and increased pressures, I find our position where we make deliberate exemptions incredibly refreshing, and I want to congratulate you on that. My question is could we actually write up a couple of case reports, a couple of business cases where we've made an exemption for a specific example and actually prove how we've saved money as a result of investing in that person And that might help equip our colleagues on the health scrutiny panel to show that to our local NHS services, saying, actually, if you invest in staff, you invest in the local population and end up saving money.
Is that too much of a political question for you, Matt? You can say, I decline to, I don't know.
What I can do is look at all the additional savings initiatives that we've put in this financial year as a response of the pressure that emerged in P2 and give you an analysis of where invest to save deliver better outcomes at lower cost. That is a qualified response to a political question that befits the role of an officer of the council.
Thank you, Matt. Councillor Crossthorne.
Thank you, Chair. First question is more of a broader one about the, in the first part, in the first report, about the cost of homeschool transport. Is there any clarity yet on whether the government's announcement on absorbing SEND costs in a few years, whether that includes also homeschool transport? And a second one is just a broader comment, to be honest, about a broader thank you. It's worth saying, certainly, last committee, we weren't particularly happy when and previous committees where we'd seen that jump in overspend from the previous quarter 4 to quarter 1 of around £20 million. There's lots of work that has gone into this and a lot of big focus on improving transparency and that robust scrutiny, and long may that continue. There's obviously been a jump down from where we were at the start of the year in terms of in-year variance, and I think that's credit to the teams. So if we can continue on that transparent basis, I think that that's a really good way forward, so thank you for the focus.
Thank you for the comments. I think on the home to school transport position, there's not been a huge amount of detail in terms of what the position for local government actually looks like, and that will be released later, I think, next year. What has been said is it's not a blanket kind of carte blanche for, you know, uncontrolled spend to happen, you know, so we are still keeping, you know, the spend under control for the DSG override. So and in terms of SEND, we don't know where that covers in terms of home to school transport as well. So it's still there's a lot of uncertainty in that space, but I think what we can do is focus on what we can control and the interventions that we can put in place. And actually early indications of this quarter's results are looking largely positive, and the interventions that we talked about in the paper about reducing the single taxi occupancy and, you know, maximising the use of our fleet and utilising personal travel budgets, better engagement with SENCOs in schools and that sort of thing, it is actually yielding results. So we're just basically focusing on things that we can control until we get some further clarity from government in terms of what that funding position looks like for DSG, SEND and that kind of area of the budget in total.
Councillor Dunn.
Oh gosh, it's worked straight away, crikey. Right, I'm going to go straight to page 323. 3.3, city goals number 4. I'd just like to expand slightly, because I mean, the general public, if they read this, will be no consultation, you know, and I think a lot of what we've just discussed in the previous item is probably how we deliver. Do you know that? So I think it would be quite reassuring for you. Now we've put these proposals forward, is how we intend on implementing and the work that we go through. Now that's slightly above what you are probably here for, but when you read that, it could be quite misinterpreted. So I just wanted some kind of reassurance that once these are out there, that the work to work with our partners, because so much of what we deliver is commissioned. So for us to achieve our budget, we need our partners and our other people to actually do that. So it was just really, when does that process start of you discussing that if it's not already started? Sorry, my voice is going now.
Thank you. I think Matt sounds like he does want to come in there. I can comment on, so in terms of the report in general, you know, taking it as read, particularly we haven't consulted on this report, but I think obviously there is a links into how we consult on budget proposals, budget development in general, and that process is underway now for the 26-27 budget setting process. But Matt, would you like to come in on consultation with partners?
No, because I was going to say exactly what you've just said.
Thank you. So we have two sets of recommendations, but before we go to them, I just wanted to say a huge thank you to the team for two really clear reports. I think the financial reports have really changed dramatically, and I think the narrative is a lot clearer, and I think it makes it a lot easier to understand, especially, you know, the report number 12, for specific for this committee. I think it's really, really clear. So thank you very much to yourself, to Philip, to Kerry, and everybody who's kind of come to briefings, etc. Because it's been a really good exercise, I think. Yeah, they are the most clear financial reports that we've had in, you know, in my time. I think they've kind of improved over time, but I think we got to a point where it's really, really nearly lay kind of speak, rather than, you know, accountant speak, which is good. So there are two sets of recommendations. The first one relate to report, so item 11. They are on page 287, and there are two. The recommendations are that the Adult Social Care Policy Committee is recommended to note the updated information on the 2025-26 revenue budget outturn as described in this report, including the detailed committee budget monitoring information and management actions provided. And number two, note the targeted actions and work underway to bring the in-year forecast overspend down. Are members happy to note those recommendations? Brilliant. And the other set of recommendations is relate to item 12, and they are on page 311 of the pack. The recommendations are: the Adult Social Care Policy Committee is recommended to note the current budget position for adult social care, highlighting the significant overspend reported for 24-25 and the underlying factors such as increased demand, complexity of care needs, and funding volatility. Acknowledge the business planning adaptations being implemented to address ongoing financial pressures, including targeted budget monitoring and management intervention aimed at improving the in-year financial outlook, and recognize the governance arrangement and oversight in place, ensuring robust scrutiny of financial and operational performance and supporting delivery of sustainable adult social care services. Are members happy to accept those recommendations? Brilliant. Thank you very much. Thank you, Jane. And that concludes today's meeting, I believe. The next meeting of this committee is on the 28th of January 2026 at 10 a.m. And may I take this opportunity to wish you all a Happy New Year. And if I don't see you before the end of December. And thank you very much for all your work.